This is a great question. How should you prepare for your upcoming surgery in terms of exercise and working out? So one of the great ways to optimize your surgical outcomes and decrease complications is to actually exercise. And this concept is actually called prehabilitation or prehab. So basically, we're getting your body ready to have surgery and recovery. And one of the best ways to do that is through aerobic exercise and or strength training. And I typically tell patients they should start that around 6 to 8 weeks beforehand. So one of the ways that we surgeons and physicians measure this is through something called metabolic equivalence, or METs. You may have heard of this. So basically, a MET is how much energy your body takes to perform a certain task or activity. So for instance, walking up the stairs, carrying a bag of groceries is equivalent to about 4 METs. And that's actually the baseline amount of METs, if you will, that we want patients to be able to tolerate before having any sort of elective surgery like plastic surgery. It's really important because it's been shown through studies that the higher METs you're able to tolerate, or the higher activity level you're able to tolerate before surgery, it actually is associated with a decreased risk of complications, and that can be as much as a 40% decrease in complications following surgery. So in terms of exercise, one of the most important things you can do is actually get aerobic exercise. And this can come in the form of anything that gets your heart rate up and working a little bit. So brisk walking, light jogging, going up the stairs, pickleball, hiking, any of those activities are really helpful in terms of getting your lungs ready to undergo something stressful, such as surgery and a recovery. So typically I recommend, like I said, 6 to 8 weeks beforehand, starting your exercise journey. In an ideal world, you would do 150 minutes or more a week of exercise, which sounds like a lot, but just remember that's about 20 minutes a day. One walk around a park or one lap around the block is about a mile. Probably take you about 15 or 20 minutes. So just think about walking one lap around the block every day, for 6 to 8 weeks before your surgery is just one component as a way to prepare for your surgery. Another great exercise option is to do strength training, especially important for females in terms of bone health and muscle strength and muscle mass. Going into surgery, you want to have your muscles ready to undergo surgery, but also to help you position yourself. So think about if you have a tummy tuck or a mommy makeover, you're going to be using those arm muscles and those leg muscles to help move you around, get in and out of bed and things like that. So it's not just an aerobic exercise that's important, it's also important to do some strength training as well. A component of prehab is actually to make sure that you're not taking in any nicotine products in the form of not just cigarettes or patches or gum, but also in the form of vaping. So I tell all patients no nicotine use before or after surgery for 6 to 8 weeks. That's another component of your prehab. In addition to that, I tell my patients to start increasing their protein intake in anticipation of surgery. That really helps set your body up for success in terms of wound healing. And then after surgery, I'm going to encourage you to continue to increase that protein intake for about 6 weeks as well. And then lastly, if you're thinking about starting an exercise regimen and you're not really sure where to go, or you don't have a gym membership, one of my personal favorites is actually Sydney Cummings. She actually has a YouTube channel for free that you can access home workouts with body weights and just a few pieces of equipment. So if you're looking for something easy to get your way into working out in preparation for surgery, I think that that's a great option. So just remember, surgery isn't just about showing up on the day of. It's about preparing ahead of time with things like exercise, optimizing your nutrition with protein intake, decreasing smoking and nicotine use. All of these things are part of your prehabilitation that will set you up for success to have the best possible outcomes with your surgery.